Hi, I'm Dr. Leslie Fall, and I am the Vice Chair for Education for the Department of Pediatrics. I have been a medical student clerkship director for 10 years. I have been a residency program director for 10 years, on and off, and I have sat as a chair of a residency selection committee in pediatrics for many, many years. And so my advice to medical students, whom I've mentored for almost 20 years now, really comes from my experience in those positions. What electives are best, both to prepare students for the specialty and to bolster their residency application? I think one of the most important things to think about is whether or not you've done a unit-based rotation at DHMC and whether or not you've done your inpatient pediatrics experience at one of our affiliated sites. If you haven't had the opportunity to do a unit-based rotation here, you really should think about doing an inpatient sub-I either on the ward, in the intensive care unit, or in the neonatal intensive care unit. And doing those will really help you recognize that you have faculty who get to know you, who can write a good letter of recommendation, but also can really speak to how well you handle the stresses of being on an inpatient unit from faculty here who know you really, really well. The next thing to think about is really how many letters of recommendation you really need and which subspecialty faculty might be able to write those for you. If you particularly have an interest in pediatric cardiology or pediatric endocrinology, taking an elective rotation with a faculty member who gets to know you quite well during that elective time and can write you a letter of recommendation is also something really important to think about. Another thing to think about, in pediatrics, people ask, well, do I have to take all my electives in pediatrics? And the answer really is no. If you have a certain set of skills you would really like to learn how to do, reading x-rays, reading EKGs, doing procedures, those elective experiences, whether they're with kids or adults, really gives you the skills that you need. And so if you feel deficient in those areas or you want to have extra time in those areas, doing electives in those skills-based areas, even with adults, is perfectly fine for pediatrics. Students also often ask me if I've done my inpatient rotations on the wards at DHMC or at CHAD, do I really need to do another one here? I think the answer is if you've spent time with faculty here, particularly in the inpatient unit, then you really don't need to do that, and you can think about doing a sub-I at an off-site hospital. If you haven't, then it probably makes sense to do a unit-based rotation here at least once during a sub-I in order to really get faculty from your home institution to be able to write you a good letter of recommendation. Does it make a difference if you're a strong or a weak student? It's an interesting question. I think the answer to it really is, if you're asking the question based on your knowledge base, the answer really is no. The most important thing you really need to recognize when you're doing an elective in pediatrics or probably any other specialty in which you're applying for your residency is what people are really looking for you to do is to demonstrate to them how you're going to be as a resident. So that includes a couple of things. Number one, what's your work ethic look like? Do you really come in when you say you're supposed to come in? Do you really pitch in and help the team out a great deal? And do you really stick it out to the end of your shift? What are your patient care communication skills like? How well do you work with the team? A really important one, how well do you accept feedback and how well do you really respond to that feedback in trying to improve your own performance? Are you defensive? Are you really open to what people are telling you? Are you open to families giving you feedback? How well do you work with children? None of those things really have to do with what your board scores were. It's important if you feel that your knowledge base is somewhat deficient, that you really do spend a lot of time at night reading, asking good questions during the day, and then demonstrating that you've really figured the information out at night and came back the next day with the information. I would worry much less about where your knowledge base started and worry a lot more about where your knowledge base ended at the end of the rotation. How important are international rotations in pediatrics? Not particularly important if you're not interested in doing something global or with global health as your specialty. And I would even say if that's something you're interested in doing, you may want to think about putting that information off to the second half of your year, doing a rotation the second half of your fourth year, or potentially splitting your fourth year. What's a lot more important for your residency application is that you've spent the time taking your boards and doing really well on them, and then doing at least one good unit-based rotation and one subspecialty-based rotation in which you get good letters of recommendation and demonstrate how well you'll do as an intern for that residency program. If you're interested in global health, it's an important adjuvant to your application, but you really don't want to make sure that that doesn't really impact negatively your basic application to the residency program. Remember, residency program directors are incredibly risk averse. They are much more interested in how well you take care of the patients at their hospital than how well you take care of patients in a third world. It sounds a little tough, but honestly they want to start there. If you're interested in global health, fantastic, but that really needs to be something on top of doing a great job first at your home institution. If you're thinking about doing two different residency programs and you really can't decide between the two of them, that's a tough question. Sometimes in pediatrics, people are applying to pediatric dermatology or pediatric neurology, in which you spend only 2 years or even one transitional year in pediatrics before going on to a specialty rotation. Other people juggle between, do I want to do OB in pediatrics, or do I want to do family medicine or pediatrics? The most important piece of advice I can give you is get a great advisor. And don't be shy to talk to your advisor here at DMS, whether it be in one or both of those specialties, about really what you're struggling with. What's most important is the fact that you can actually keep an application open to two separate residency programs and let the match decide for you. But I worry a lot about a student who's had to really put off that decision up until match day. The other thing that's really important is, unfortunately, you really can't let each residency know that you're applying to the other one. Because remember rule number 1, residency program directors are very risk averse. They really want to know that you are dedicated to their residency specialty. So yes, you can apply to two separate programs, but you have to make sure your letters of recommendation stay independent, that your applications don't cross paths, and honestly, that you don't apply to the same hospital with two different residency programs, because believe me, sometimes people are married to each other and that information may get out, and you may not be thrilled with the fact that people begin to question whether or not you're that committed. So the answer really is you can do it all the way up to match day, but honestly it probably would be better to make that decision before you go too far into your final application. Transitioning from third to fourth year medical school can often be a really fun and interesting transition. You've come through your third year, you're sort of done auditioning for everybody and getting great grades, and regardless of what you do, and now it's time to really focus on what you want to do with the rest of your life. At the same time, it also means that the focus really turns away from you and your grades to you performing as a physician. So what's much more important is that you've really decided to dedicate yourself to a single specialty, that you've demonstrated that what's most important to you is your patient care, how well you are participating and functioning with your team, how you are able to advance your patient's own care through advancing your own knowledge. Yes, grades are still important, but your grades are a lot more dependent on your ability to demonstrate what a great physician you're going to be, rather than demonstrating how well you did turning in your write-ups or how well you did on your shelf exams. So the upside, it's a lot more fun. You actually get to be a real doctor and show how good you're going to be at it. The downside is now you're a real doctor and what you do every day really starts to matter. How much do you really need to know when you graduate medical school? Well, the answer, if you really ask me, doesn't really depend so much on what you know. It really has a lot more to do with who you are. The most important thing that I think you need to know graduating medical school is number 1, how to ask for feedback, how to receive it, and how to act on it without being defensive. Another really important aspect of what you need to know is you need to know how to be a team member, how to be there for your team, how to be there for your patients, and how to be there for anyone who really needs you to be there for them. Much more so than wondering what time it is that you're going to be able to get home, or whether or not your duty hours have been met. Granted, those are really important things these days, but honestly, what you need to begin thinking a lot more about is how are you doing as a physician, how are you listening to that feedback, and how are you acting on it in the best interest of your patients. And by far the most important thing to know how to do when you graduate medical school is how to say, I don't know the answer to that, can you help me?